Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preventing falls at the hospital. Introduction. Falling at the hospital can result in injury, additional surgery, or even death. Falls can unnecessarily prolong your hospital stay. About 1 million patients fall at hospitals in the U.S. every year. Your health and safety are our top priority. This patient education program explains how to prevent trips and falls during your stay at the hospital. What to tell your healthcare team. Members of your healthcare team include the nurse, physician, physical therapist, and patient care technician. They will work with you to keep you safe and comfortable. Every hospital patient is at risk of falls. If you have fallen before in your home, you are more likely to fall while staying in the hospital. Make sure your healthcare team members are aware of any past falls you have had. During hospitalization, you may experience new symptoms and medication side effects, including low blood pressure, weakness, tiredness, and trouble sleeping. These are called risk factors. They can increase your risk of falls. Tell your healthcare team if you feel dizzy, disoriented, sleepy, or confused. Tell them if you are having trouble with balance or staying alert. Leg numbness or weakness makes it harder to balance. Tell your healthcare team members if your legs ever feel weak or numb so a team member can help you get around. Tubes and machines attached to you or around you increase your risk of falling. Falls can happen on the way to or from the bathroom. Rushing to the bathroom or going to the bathroom often increases your risk. Take your time. Tell your healthcare team members if you use the bathroom often. They may have suggestions on ways to reduce the risk, such as taking scheduled trips to the bathroom, especially before bed. Ways to prevent falls. The call light is a button that helps you call for assistance. Ask the nursing staff to show you where the call lights are next to your bed and in the bathroom and how to use them. Always make sure that the call light is within your reach before you go to sleep. Walk slowly and carefully. If you have any risk factors that increase your risk of falling at the hospital, ask the nursing staff for assistance anytime you want to move around in your room. If you have the slightest doubt about losing your balance, use the call button to ask for assistance. There's no reason for you to walk alone. Do not use objects like a bedside table or IV pole to help you get up or to lean against as you walk because they increase the risk of a fall. You should only use designated canes, walkers, crutches, or handrails for assistance. Some people feel dizzy or lightheaded when they stand up suddenly. Take your time to help your body adjust from sitting or lying down to standing. When you wake up, sit at the edge of the bed briefly before standing. Before getting out of bed, make circles with your toes, bending at the ankle. This gets your blood flowing and keeps your feet flexible and strong. If you use a wheelchair, ask someone to lock the brakes and move the footrests out of the way before sitting in it. If you drop something on the floor, ask someone to pick it up. Don't lean forward or you might tip out of the chair. Wear non-slip comfortable footwear that fits well. If you don't have non-slip footwear, ask your healthcare team for a pair. If you wear glasses, put them on before walking anywhere. Even patients who have no trouble walking at home can still trip at the hospital because of the unfamiliar environment. Make sure the room is tidy and the area between your bed and the bathroom is clear of clutter. If you notice a spill in your room, ask your team to dry the floor. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel. Preventing falls at home. People are 3 times more likely to fall at home than at the hospital. The following suggestions will help you prevent falls at home. 1. Wear non-slip, comfortable footwear that fits well. The following footwear can increase your risk of falls: high heels, floppy slippers, shoes with slick soles, walking in socks. 2. Use nightlights, handrails on the stairs, grab bars in the bathroom, and non-slip mats in the bathtub. If you do not have those in your home, consider installing them. 3. Use a cane or walker if needed. Ask your doctor for recommendations on the best options for you. 4. Cut down on clutter around the house. The more cluttered a room is, the more likely you are to trip over something. Make sure walkways and high traffic areas are clear of boxes, newspapers, electrical cords, phone cords, and furniture. 5. Secure loose rugs, carpeting, and floorboards. Rugs in the living room and bedrooms can increase your risk of falling. 6. Clean up any spills on the floor right away. 7. Use non-skid floor wax. 8. Store commonly used items like clothes and dishes within your reach. 9. Have regular vision tests and use corrective lenses if you need them. Sharp vision goes a long way in preventing falls. 10. Keep your home brightly lit with at least 100-watt bulbs to avoid tripping on objects that are hard to see. Anytime you feel dizzy or are having trouble balancing as you walk, sit down. You can sit on the floor if there are no chairs nearby. This way, if you lose your balance or faint, you won't fall and injure yourself. Falls are less likely to cause injuries if your bones and muscles are healthy. To keep yourself in good shape, exercise regularly. Your exercise routine should include strength training, stretching, balance exercises, and weight-bearing activities such as walking. Take calcium and vitamin D supplements for strong bones under your doctor's supervision. Also, make sure you have enough of all other nutrients needed to keep calcium in the bones. Do not smoke. Smoking weakens the bones. Avoid alcohol and drugs. These can increase your risk of falling. Practicing good habits can prevent falls and serious injuries. They keep you as safe and comfortable as possible during your stay at the hospital. For more information on how to prevent falls, ask your healthcare team. Thank you for using Explain.